As you've noticed, I'm not Andy. I think we should probably start, as Andy likes to start, and say that we will get through this together. I'm here today to deliver the Fast for at 4, And I want to start with something that's very important, Breast Cancer Awareness Month. October is nationally recognized as Breast Cancer Awareness Month. It's a time each year when we recognize survivors of breast cancer, acknowledge individuals who are living with metastatic disease, and honor the memory of those we have lost. This month is also a time to raise awareness of preventative measures that women can take and of the importance of regular screening. Breast cancer is one of the leading health crises for women in the United States, and unfortunately, too many of us know someone who has been impacted by this disease. 1 in 8 women will be diagnosed with breast cancer in their lifetime, and the American Cancer Society estimates that 3,800 Kentucky women will be diagnosed with breast cancer in 2020. Fortunately, diagnosing breast cancer in its early stages reduces the risk of death from the disease and increases your treatment options. That's why it's so important for women ages 40 and over to get regular mammograms. Providers are encouraging patients to continue their routine screening schedules even during the pandemic. Get in touch with your healthcare provider to discuss a plan to stay current on your screenings while also taking precautions against coronavirus. Insurance generally covers the cost of most routine screening mammograms, but uninsured and underinsured women may receive a screening mammogram through the Kentucky Women's Cancer Screening Program. This is a great federally funded resource provided through our Health and Family Services Cabinet. For more information and to find healthcare providers, please call 1-844-249-0708. I am honored to partner with the Kentucky Cancer Program to continue the legacy of Kentucky First Ladies before me by supporting the Celebration of Hope. This is a wonderful event, which we lift up and honor Kentucky's breast cancer survivors. This event is special to me in part because of the memories I have of Horses in Hope that my mother-in-law, Jane Beshear, hosted in her time as First Lady. Sadly, we cannot have an event together this year due to the coronavirus, but to all of our survivors, please know I am thinking of you and am so inspired by your resilience. To everyone out there fighting this disease, your strength of spirit is so powerful. I'm sending hope to you in your fight. To honor those we have lost, I call upon all of us to commit to raising awareness and sharing breast cancer education so that all women have access to screening, treatment, and hope, regardless of their circumstances. For additional support and resources, you can contact the Kentucky Cancer Program at 1-877-326-1134 by visiting kycancerprogram.org. Second point is Coverings for Kids. I launched the Coverings for Kids program with Lieutenant Governor Coleman back in August as a way to support our school districts with additional face coverings as they prepared for the return to in-person instruction. Since that day, I have been so proud to see people all across the Commonwealth step up in response to our call to action. I haven't been surprised, though, because that's what we do on Team Kentucky. We look out for one another and support each other when there is someone in need. Wearing a face mask is one of the best ways to prevent the spread of the coronavirus, and your donations are helping to ensure that everyone in our schools can access a mask if they need one. Obtaining masks can be difficult for some families, and we know that young kids especially are likely to either lose their face mask or get it a little dirty out on the playground. These donations provide an extra pool of resources for our students, teachers, and staff, making safety a bit more accessible for everyone in our schools. I want to extend a huge thank you to everyone that has made mask donations to their schools. And thanks to your generosity, over 40,000 masks have been donated to Kentucky school districts so far, and more are on the way. Many of those donations are handmade and are often donated in large quantity, meaning that there are so many Kentuckians out there giving hours of their time to ensure the safety of those in our schools. I want to share the story of two such people, sisters Marty and Phyllis of Muhlenberg County, who felt called to action from the moment that Dr. Fauci announced that Americans should wear masks to protect themselves and others from COVID-19. They made masks of all sizes and varieties for members of their community and carried them everywhere to give to anyone that needed them. When they heard about our Coverings for Kids program, they instantly thought of Muhlenberg South Elementary, where Phyllis's granddaughter, Autumn, is a student. They knew that there were students in need of masks that would have a hard time getting them. Marty and Phyllis made arrangements with the school principal and graciously gave their time and energy to produce 2 masks for each student and faculty member for a total of 566 donated masks. To Marty and Phyllis and all the amazing people on Team Kentucky who have given their time and effort to donate masks to our school districts, I cannot thank you enough from the bottom of my heart. Thank you. And thank you to our teachers, school staff, and administrators for your dedication and commitment to providing an education to our students this year and every year. As the parent of a 5th and a 6th grader, I know this year has been a challenge on many levels. I'm deeply appreciative for everyone that is doing the work of educating and supporting our students. Our schools still need your help, and I'm calling on you once again in this effort to help support them with extra resources. Most of Kentucky's schools will have made some form of return to in-person instruction by the end of this month, so we are making one final push for donations in the Coverings for Kids campaign before we close out the program on October 30th. For information on the program and how you can get involved, visit the website listed on the slide. We'd love to share your stories, so be sure to use the Coverings for Kids hashtag on social media. I encourage you to keep donating masks to your school districts by the deadline of October 30th, if you can. Wearing a mask is one of the best ways to prevent the spread of the virus, just so crucial right now. You are helping to make masks more accessible to our students and staff that may be in need. Voting. This year has looked different in many ways. Big one for us personally, for me and Andy, is missing our trip to the polls as a family. We've always made it a priority to take our kids with us to vote and to show them how important it is to participate in our democracy. Andy and I chose to vote absentee this year, and while we didn't all get to go to the polls together, we still made a commitment to making our voices heard in this election. I returned my ballot at a drop box. Andy returned his through the mail. Both ways are safe and easy. I want to remind you that regardless of how you vote this year, it is important that you know your options and commit to a safe voting plan. Voter registration for Kentucky ended this Monday, but registered voters still have time to request an absentee ballot if you have concerns about voting in person due to the coronavirus. That deadline is fast approaching, Friday, October 9th. So, 3 days. Make sure you go online to govoteky.com. Call your county clerk's office to request your absentee ballot as soon as possible. Kentuckians have more voting options than ever this year. Whether you plan to vote absentee, early in-person, or in-person on Election Day, make sure you have a plan in place. It's important to be aware of the upcoming dates and know what your options are. So again, visit govoteky.com or contact your county clerk's office for information about how you can vote in your county. No matter what your plan is, follow through on it. Vote. Make your voice be heard. 4, mask up, Kentucky. I've said before that wearing a mask is one of the best ways to prevent the spread of the coronavirus. Right now, as we continue to see high case numbers, it is crucial to practice kindness to others, to set a good example by wearing a mask when you are out in public. It helps protect you and the people you care about. So today, we will continue to recognize people and groups who are setting a good example by masking up when they are out and about. So we have some different people who all participated in a virtual Susan G. Komen Race for the Cure to raise awareness for breast cancer. Instead of having an event with everyone walking in a big group, everyone participated on their own, wherever they were in the state, and masked up to keep themselves and those around them safe. Thank you for wearing your masks, for raising breast cancer awareness. Let's see, next. This one is at EKU's School of Nursing. This is Professor David Coffey's clinical group. They're creating change with the University of Kentucky Children's Hospital. You all are pursuing an amazing profession, and I thank you for leading by example, for keeping up the good fight with COVID-19. Finally, we have an amazing example right here of people masking up and making a Coverings for Kids donation to Boone County Schools. Thank you to the Perfetti Van Mel Company for donating 500 child-sized masks to help keep Boone County children, students, and faculty safe this school year. Thank you to these individuals for setting a good example by masking up. Our team will be reaching out to get you a Team Kentucky mask. And before I turn it over to Secretary Friedlander, I know Andy and Dr. Stack have been out here day after day urging Kentuckians to wear a mask. I implore you, please, wear your mask. I was taking my son to school this afternoon and I saw all of the kids walking with their parents, going into school, and they were so excited. Please, let's help keep these kids in school and let's get the rest of our kids back into school. Please, wear your mask. It's important, it saves lives, and it helps our children to thrive further in their schools.
Good evening. I'm Secretary Friedlander, the Cabinet for Health and Family Services. I have talked to Kentucky before and the folks assembled here before about childcare. So today I have an announcement about childcare. First, I want to say there are about 1,781 licensed facilities across the state. We still see 55 that are closed. There are about 218 registered child care centers across the state. We still see about 13 that are closed. Now, when we originally started, we were worried about higher numbers than that. But there are child care centers across the state that are still struggling, that still need more support, and we understand that. As of last week, we had 14 centers apply for some of the additional funds to help them get registered to become registered providers for additional child care. So that process has started, and we think we're up to about 14 right now. One of the ways that we provided some relief was about $225 per child who were enrolled in an existing licensed or certified child care center. What we are doing today with some additional CARES funds are we are going to provide an additional $130 per child for registered and licensed child care centers. We believe that this will help keep some of those centers open, help keep some of them going. And those fundings are primarily provided for employer wages, facility rent and rent payments, mortgages, utility payments, insurance payments, and then some of the additional costs that child care centers have had to incur through this COVID crisis. So we're excited to announce that today. That'll be at about an additional $20 million to child care centers across the Commonwealth. And as the First Lady said, please wear a mask. You're doing this for everyone around you.
Thank you to Secretary Friedlander, and while I think he does a great job, I think our first speaker today is pretty special. We've got an amazing First Lady who cares about each and every one of you out there, that gives of her time, which is like so many that like us are raising kids already so busy to try to do the right things. And I hope you will hear her message like you hear our message. That we need to follow these guidelines, we need to mask up. I think I saw a letter to the editor in one of the newspapers today about government offices. And it was something that every government office should be fully open like driver's licenses. I just want to tell people that we are still in the midst of this virus, and it's impacting state operations too. For instance, today we have 3 driver's license offices closed because of at least one positive COVID test. One is in Louisville. It's the second time that they've had to close. One's in Elizabethtown and one is in Prestonsburg. Previously, we've had them in Madisonville, a separate one in Louisville, and even in Frankfort. We follow the Healthy at Work protocols. We work hard. But remember, this is a virus that really spreads. So we are going to continue to have the ability to apply to renew your driver's license by mail and by other means. And remember, these folks that work there are your neighbors and they're your friends. And let's make sure that we're doing everything to protect them too. And we cannot allow inconvenience to take our eye off the ball and what we need to do for COVID. Yes, doing a lot of things differently is going to mean some take more time or more difficulty. But the right thing is the right thing, and oftentimes it's hard. So what happens when we have a positive test is we send the employee home. They're told to monitor their symptoms and test if indicated. Closure signs are posted on doors of those offices. They're posted on social media. The offices are deep cleaned, sanitized. Minimum shutdown is 96 hours. We cooperate with the local health department on contact tracing, and customers with appointments are notified and they are rescheduled. But government offices, just like every other part of Kentucky, is having to deal with the virus. And remember, it's not what capacity we set that is the real threat. It is the inability to stop a virus that shuts you down 100% for a period of time. And we got to make sure we continue to have the humility that we are in the midst of an epidemic, that it can strike, that it can be deadly, and simply this concept that we got to live with it now and we should go back to normal. We can't go back to normal, not in the midst of this pandemic. We will get there, but it's going to take time, and we got to stay strong. All right, today's report includes both new cases and includes a significant effort to get through Fayette County's backlog cases and get them up to date, current. So I'm going to give you an overall number that is for today that is startlingly high, and then I'm going to break it out and how many of them are truly today and how many of them are backlogged cases. Even without the backlog cases, we're on pace, unfortunately, to have another record week for the most cases that we have had. Now, we have always reported statewide cases when we receive them. It's the only way we can do it, because otherwise we're going to go back and edit numerous reports. But we are providing transparency in how many of these are truly today and how many of them are getting Lexington up to speed. So today we're reporting 2,398 cases of the coronavirus. Breaking those down, we're reporting 926 new cases today. That is a significant number in and of itself, and as it compares to the last several weeks, it is the second highest number of those last 4 weeks. There are 1,472, we'll call them historical cases. They're mainly from the last month and a half from Fayette County, so many of those could even be in the last several weeks. We believe that with the exception of maybe a couple hundred, which will come in over the next couple days, this will get Fayette County caught up and current. I'd reiterate that we need our local health departments, which are working really hard to timely report the data, and we see that the vast majority of them have, and this is a way to get one of what has been one of the slower, based on the number of cases, certainly one of the slower health departments caught up, and so the state numbers and the local health department will be reflective. Now, those are all real cases. Just because they didn't happen today. Those are 2,398 individuals. We hope most of them are asymptomatic. But You can apply the same percentages, whether it's 1.7%, which is the mortality rate, or the higher hospitalization rate, and know there are a lot of Kentuckians out there that this virus is affecting. 358 of today's cases are kids 18 years or younger. And these cases that we're reporting today, the 2,398, they all go into the overall number of cases because they hadn't been previously included in it. That gets us up to 76,587. Certainly more cases than we want. Our positivity rate, however, remains in a pretty good place at 4.21%. Number of tests continues to rise, 1.568 million. 672 Kentuckians currently hospitalized for COVID, 161 in the ICU, 79 on a ventilator. New cases by county, and remember, there are 1,472 Fayette County cases that were over the last month and a half that are included in these. So Fayette County today, 1,510, Jefferson 192, Warren 31, Hopkins 30. Remember, Hopkins was hit really hard early on, about 20 deaths plus coming out of one major super spreader event. Again, it shows you how this virus can strike. 28 from Davis, 25 from Kenton and Laurel, 21 from Bullitt and Scott, 20 from Boone, Hardin, and Henderson, 16 from Knox, 15 from Christian and Whitley, 14 from Callaway, Pike, and Shelby, 13 from Franklin, Knott, Letcher, 12 from Adair, Boyle, and Todd, 11 from Graves, and 10 from Allen. Sadly, today we've lost 5 additional Kentuckians, and we expect in the next several weeks these daily numbers will go up as the number of cases have gone up. Each one is an important individual whose family loves and misses them. Today's report includes a 65-year-old man from Harlan County, a 80-year-old woman from Greenup County, a 75-year-old woman from Whitley County, a 68-year-old man from Fayette County, and a 79-year-old man from Henderson County. Today we've got another one of those examples of the fact that this is not just individuals on a spreadsheet, but real people who are loved and who are missed. Today we're remembering Michael Reynolds, who died at 58 years old, who lived in Louisville. On Tuesday, October 6th, Michael Reynolds of Louisville lost his battle to COVID-19. Michael was just 58 years old. His niece, Miss Fisher, shared that Michael could always be found spending time with his family and friends, listening to music, watching sports, and shopping. She bragged he had the biggest and best wardrobe that anybody had ever seen. He was known for his sense of style and always talking about his children, grandkids, fiance, and friends. He loved them all so much. Known in Louisville for his one-of-a-kind style, his events and dances, and being an all-around friendly guy, Michael was the cool cat to all, and he will be deeply missed. Miss Fisher asked that we share the story of her uncle to stress the seriousness of COVID-19. 58 years old. Let's make sure that we continue to light our homes up green. Let's do it tonight in honor of Michael and his family. Let's continue to ring our bells at 10 in the morning. More importantly, let's mask up so we don't lose any other Michael Reynolds, and we don't have families like his that have to go through what I know this family is going through. A couple of areas that we report on each day: long-term care facilities, 48 new residents having tested positive, 22 new staff, 3 new deaths attributable to members of those facilities. Kentucky Child Care facilities, 8 new facilities with at least 1 positive case, 7 new staff, 5 new children. Now the colleges and K through 12, we are using the rest of the week to automate. It's going to cut down about 9 man or woman hours in our Department for Public Health. The dashboard is available online, up to date, between now and I think Monday, when we will have the audited system, which is that secondary one that we report each day, back up and online. Wanted to mention the Thompson Hood Veteran Centers in Wilmore continues to have more positive tests. Now at least 25 veterans having tested positive. The center is conducting facility-wide testing of all veterans and all employees every 72 hours, as well as testing anyone showing COVID-19 signs or symptoms. Employees are screened daily, as well as tested every Monday and Thursday. Protocols for isolation and safety are in place, and a COVID unit has been established in accordance with the guidelines and recommendations. 9 symptomatic veterans have been transferred to the VA Medical Center in Lexington. And the facility is working with the VA, the State Department for Public Health, and the local Jessamine County Health Department. We wish these veterans who have served our country a full recovery, and we're going to be working as hard as we can to ensure that that happens. Now I think we're going to hear from Dr. Stack a little bit about where we are and get his thoughts, and then we'll open it up to questions.
Thank you, Governor. Good afternoon, everyone. I just want to comment briefly on the Governor talked about the number of new cases today. I know this is complex. It's frustrating. It's frustrating for all of us. There's a lot of moving pieces, but as we go along this path, it's good news that we're able to make things better. And so we worked with Fayette County to get their numbers caught up, and they'll never perfectly align, but it's going to be a lot tighter now going forward. So I'm very grateful that we were able to get that to a better place and get it there going forward. We'll have additional information going forward about when we find labs who have come forward and given historical data, and that causes these big leaps where sometimes there's 50,000 or 70,000 new tests that show up in our total number tested. That's a good thing that we're finding these labs, and we're onboarding them for electronic reporting and getting better quality data going forward. So I know it's frustrating. It's frustrating for all of us, but it's part of the journey, and I certainly hope at the end of the coronavirus we emerge with a better system at the end of this than we had going into it. So for other issues that happen in the future that are hopefully much smaller than coronavirus, we're much better prepared going forward to keep people in Kentucky healthy and safe. I want to talk about what's happening as our cases go up, hospitalizations follow, and the vulnerable eventually get exposed. We've put a lot of things in place to minimize this risk, but this is what happens. And so for our admitted patients in the state of Kentucky, if I look back over the summer, we would run in the 300s, 300 some odd people a day, 350, 330, 370 in the hospital on any given day in Kentucky for COVID-19. And this is a visual estimate, but from September 21st to 28th that week, we had about 380, give or so, people in the hospital for COVID-19 across the state of Kentucky. The week after that, September 28th through October 3rd, we had about 430 to 440 people a day in the hospital in the state. Reporting always dips a little bit on Saturday and Sunday. We work real hard to avoid that, but it's inevitable, unfortunately. The last 3 days, now remember I said 430 to 440 people a day in the hospital. October 5, 469. October 6, 503. October 7, 541. So 469, 503, 541. That's the last 3 days, and that's up from a base of about 430 to 440 the week before. Here's the point, folks. I'll be as matter of fact about this as I can. When more people get infected, eventually more people go in the hospital. Some portion of them go in the intensive care unit. and then a portion of those end up dying. Those numbers are very consistent. They're very producible over time. We've seen that pattern over and over and over since this all began for us in March, across the country, that is. So in Wisconsin today, there's been a lot of news coverage about this. Wisconsin has activated a field hospital that they custom built earlier in this emergency response with the Army Corps of Engineers, a 530-bed field hospital that they've activated or will activate on October 14th. The public health experts there are commenting, like we would here, that bringing more people together, having more activity has caused some of this escalation, but another big driver is people not following the guidance, not wearing masks, not socially distancing, not doing the things we know would help. So as of today, apparently only 16% of the state's 11,452 reported hospital beds were available as of actually yesterday. And this is in a state where, like others, including here, there are lawsuits in place to block the mandate to wear a mask. I do admit some puzzlement when folks say, so what are you going to do next? What are you going to mandate next? I would say that we have very good guidance in place. The guidance is wear your mask, socially distance, keep your hands clean, and you should also stay home if you are sick. Always we have respiratory infections increase in the fall. Of all years, stay home if you're sick. If you have a fever, a cough, a runny nose, a sore throat, any of those things, do not go to work, do not go to school. Stay home until you're better, and if you feel you are sick enough to require care, get tested or get checked by your healthcare provider. So let me offer this. I'll conclude with a little story here. I said a couple days ago, or a few days ago, write me some letters, and so they're starting to come in now. And this individual said that I could share their name. So this is from Miss Patricia, who's 75 years old and a former military veteran. Thank you for your service to our country, Patricia. And she says she is concerned for herself because she has significant medical problems and is 75, and so this is obviously a danger for her. She's in the high-risk category, so we're going to do everything we can to keep you safe, Patricia. Why am I concerned for other Kentuckians? I am concerned for all my fellow Kentuckians as I love them all. I love my state and was born and raised in Kentucky, although I've lived in several places. My old Kentucky home is in fact my home. I want all Kentuckians to wear masks, wash their hands, and social distance, not to protect themselves, but to protect all those they love and even those they don't know. Ms. Patricia, we are going to do everything we can here from the Capitol to try to keep you safe and to keep everyone else safe. What we need is all of us to care about each other, be kind, and take those steps that we've already announced to keep each other safe. We can always go back to more aggressive things in the spring, but society's moved on to a different place, and ultimately it's going to require all of us to understand just how serious this situation is. I said this more than once, and I said it in a series of tweets over the weekend. It really is like a casino, where the virus is the casino and the house always wins. If you take your eye off the ball, I don't know where it will hit and who will get hit hardest, but I know this, it will come and it will get us, and that's not in any of our best interests. So folks, it continues to be a privilege to serve. I look forward to the opportunity to celebrate when we finally put this behind us, but we've got a lot of months ahead of us still to get through. So please, wear a mask, socially distance, wash your hands, stay home if you're sick, and get tested if you've been exposed or have symptoms so that we can work with you to keep you from infecting other folks and keep people safe. Thank you, Governor.
Thank you, Dr. Stack. And all I'd add is let's always continue to look at our processes for keeping people safe in your workplace. Each day, what are a couple of other things that you notice that we could do better? We're trying to do that here today. We actually have multiple podiums about knowing that it can be spread potentially even through the air, spreading us out a little bit more. It almost looks like we're having a debate here in the Capitol, but again, we're always trying to look at ways that we can improve. All right, we will open it up for questions. We'll start with you, Catherine.
Governor, have you talked to Senator Beshear? What are your thoughts on the most recent conversations around stimulus payments?
Question is, have I talked to Senator McConnell recently? No, I haven't talked to him personally. I know he's in the midst of a campaign. Our offices do communicate. We need another CARES Act bill passed through Congress. And just because they failed to do it doesn't mean they should take the position that it's not necessary. The president said it's necessary. The House Democrats have said it's necessary. Surely the Senate Republicans believe it's necessary too. Again, it is not about partisanship. It's about everything from help to individual Americans who are Democrats, Republicans, Independents. It's help to state and local governments that could be red or blue or purple. I mean, in the end of the day, most of what we do is provide services that aren't guided by philosophy or political philosophy at all. And it's just a shame that in the midst of a pandemic, that we let an upcoming election stop us from getting work done. And it's a shame, with everything on the line, that everybody's not at the table, because some people aren't participating at all, and people would walk away from the table. When you got to get something done, you can get everybody in the room. Right now you can do it virtually, and you get it done. And that's our job. That's what we're elected to do. And so I hope that they can reach an agreement, reach it before an election, and reach it as soon as they can, because it's going to have ramifications for every family and every government across the United States. Joe?
What feedback did you receive from your call with mayors and judge executives on Tuesday about compliance matters? And are there any particular counties that are struggling getting people to comply with the COVID regulations?
Questions about response on our call with mayors and county judges on compliance, enforcement, encouragement, call it any of those, on what we need people to do to defeat COVID. We had a limited amount of time for questions. Certainly, county judge for Owsley County, for instance, talked about how we all need to step it up, that it's serious, and Owsley is in the red, so it was good to hear what he was ready to do. Heard a little bit about some changes that I think we can make in code enforcement. Some cities not being able to get people to cut their grass. That's something we ought to be able to deal with in the midst of this. But my sense is that everybody wants to do the right thing and is ready to do that encouragement. The real response will be what we see in our communities. Also heard from Judge Dan Mosley from Harlan on the call, because they had an earlier outbreak. They had a good response in really promoting people wearing masks. They've canceled their annual festival and even turned that into encouragement of people wearing masks. They now have another outbreak. He and I agree that people have gotten more casual about it, and I know he's ready to step up and do some of those same things that he was doing before. Hopefully we'll see in their own way every local leader trying to do their part. There may be some that feel more comfortable walking into some of their establishments and telling people you really need to do this, and there may be others that are willing to take stronger enforcement methods. Certainly in some of our larger cities, especially with bars, we need to see more direct enforcement. Tom?
Governor, you and the First Lady and Dr. Stack all spoke about the need to wear masks. And you mentioned yesterday that you've extended the mask mandate. There's signs on the doors here at the Capitol that you get your temperature checked and you're supposed to wear a mask. Yet there are at least 2 constitutional offices where they do not, and they walk right past the temperature check. Is there anything you can do about that?
The question is, here in the Capitol, we put rules in place where you get temperature checked. You have to wear your mask. It's the same things we're asking everybody else to do, because we shouldn't put ourselves above others in government. And we've seen what happens when you do that in a place of work, even a governmental place of work. The reporter has told me that there are 2 constitutional offices in this building. And remember, there are only 4 in this building total. And I know the governor's office and the lieutenant governor's office all wear masks. That don't wear masks, and many try to avoid the temperature check. I've seen them take the temperature check. When I'm there, I certainly see them in a mask coming in. But if there are constitutional offices in this building where the employees are not wearing masks, your employer is putting you at risk. And they are acting like they are above the rules that apply to everybody else in this Commonwealth. If one is the Attorney General's office, he said the mask mandate has the force of law. And if they are not wearing it, that's a real problem too. But how about we just set a good example? I mean, it might not be the constitutional officer, I mean, they're both young, that gets it, but what about everybody that's worked there for a long time? And when you as a leader don't do it, sometimes other people feel like they shouldn't do it in front of you because of the example that you set. So that is putting other people's health at risk. I hope none of our constitutional officers would say they don't think masks work. They'd say, well, we should just trust people to do the right thing. I've heard that out of at least our Attorney General. If he's not wearing a mask inside his own office, then that's the end of his argument, right? I mean, if it's about people will do the right things without a mandate, why isn't he wearing it, and why aren't people in his office wearing it? Now, I say all that based on the question that you asked me. I haven't seen that myself, but everybody in this Capitol needs to be wearing a mask, needs to get their temperature checked, and my goodness, if they don't, and they create an infection here that impacts the individual employees that work for them, there's potential liability there, and these other offices, that would not be acceptable whatsoever. Joe, that was a long answer.
Regarding the backlog from Fayette County, can you kind of explain what exactly happened there with the backlog, and how does that actually impact the positivity rate in terms of how you guys are reporting tests?
So the question is on the Fayette County backlog, how did it happen? It's really simple. They weren't getting the data into the system to report to the state, and they knew they had it, and it wasn't getting done. We have now worked with them. I think we loaned them people even to help put it in, but we've been in this pandemic long enough. It shouldn't have happened, but we're getting them caught up, and we're going to make sure that we stay caught up. We've got to make overall state decisions at times where we need that data. You know, Fayette County Health Department is also the last health department not currently using the contact tracing software that can be shared all across the state, and hopefully they're coming on board with that, because they're going to lose hundreds of thousands of dollars if they don't in funding that's out there. What was the second part? How does it impact the positivity rate? Well, one of the things that we're seeing is we're also having large number of tests come in at different points in time when we find a lab that's out there that has it. Steve, you want to correct me?
These are cases, not tests, so this doesn't change.
Right, but the denominator has the large number of tests as they come in too.
Yeah, but these two things wouldn't connect.
All right, I'm going to call on Dr. Stack to come up and answer the question about the positivity rate at his own podium.
I'm adapting to the
We want to get it right.
I can leave my mask. So these are cases. So these are individual people that are in our investigation software, so we know who they are. The positivity rate is based on just tests, the number of people tested. They're different metrics, they're different calculations. So the number of cases is not used to determine positivity rate. It's the number of people who are tested and whether their test is positive or negative divided by the total number of people tested as the results come in each day. So the positivity is not impacted by the number of positive cases we report in that calculation.
Isn't it possible then that the positivity rate, if we're talking the last month or so, have actually been higher?
No, what happened is we get, there's all these different data systems. The tests come in, and we get a total numerator and a denominator, and we can do that calculation. The local health department enters the patient's information into the contact tracing solution, and then also the National Disease Registry. And then that, once it's validated, that's what populates our case reports. That's all the detailed information, all the stuff that we use for contact tracing and understanding, cluster evaluations where there's breakouts and clusters. the governor reports when he says the number of cases every day, with rare exception, like today we have a different situation because we've got this big backlog. Those are unique, new individual people. Now these are people that Fayette County has contacted and done all the other regular work, but they didn't enter the data into the shared system that we use at the state level. So they've been reporting numbers, but we've not had this information in that data system, and we rely on them to validate it. And I guess maybe I'm talking too long on this particular point. This does not change the test positivity rate calculation today. This does not impact that particular calculation.
Anytime we don't have all the data, I think that there could be impacts. I would say this is stretched over a period of about a month and a half, too. And we have been, and we'll talk about this next week, we have been following our positivity rate, both in all the information as it comes in and then what we get electronically as a smaller sample set to determine if they look about the same, and they've been tracking right about the same. So we feel pretty good with the overall positivity rate. Could it be a couple hundredths of a point off on any given day? Sure, based on that data, but we do feel like the positivity rate has been pretty accurate, and we can show you these comparisons next week and how we've been trying to monitor it and double check it.
And as I walk away, I'll just say the governor just said, we'll talk about that more next week, because I understand it's been a frustration and people can't replicate things. We'll try to yet again be clear about that next week and discuss that in more length.
And on the electronic side, which we'll show, we can give you the numerator and the denominator that we're using, which people can see. It's not all the cases, but it's a subset that we can compare to the overall number to test it for accuracy.
It doesn't always feel like it in the moment, but we're actually making progress and getting better data systems as we go through this. So we'll talk more about it next week.
Catherine?
I have a clarifying question on this before you walk away. Don't do that. So are you saying that this testing data would have been reported in another data set already in the past, and that these positive case numbers are a different data set? If that makes sense.
It's very clear. What I'll have to, because there's so many moving pieces in the complexity. Cases are when the epidemiologist had taken the test information for a positive test, confirmed that they are positive, and then has now begun to work the case. And that usually happens pretty quickly. The result comes in and it gets picked up and it's done. And that was happening at Fayette County. The people in Fayette County were getting phone calls and getting the information. So that was happening. But because these IT systems are archaic a lot of times and don't communicate with each other, they have to then go and manually enter, because they have their own contact tracing solution that's not the state one. And they have to then go and enter that information into a second data system.
Because they haven't transitioned to the state's contact tracing system.
And so what we weren't getting is when we would report to you like new cases, that part of the process had a gap, and it was a yawning gap. It was like 1,900 people or cases that weren't showing up. And so some of them came in over the last few days in a trickle, and then today we finally got that big catch up and we snugged it. But the tests we get from laboratories, we have to do phone calls and surveys to get what's the total, and they put some online, what's the total number you've tested, and they report that. And then we also get a total number of positives. So we get less information, so we can't tell you it's a case. We just know from the labs there's this many positives, this many negatives, and we do the math. And you all can't replicate our numbers because it's a really heavy, intense manual process, and as we do this and try to make sure the things are valid, it's just there's all these different data sets for these different purposes. And we'll talk about the positivity rate next week in more length, because we do want to we want to let the home epidemiologists be able to play with their Excel spreadsheets if they want to. So we're going to try to make that easier in the future.
But it should be that Fayette County's incident rate was higher during those periods of time than what we had on the state level. And that's positives per 100,000 population.
And the governor's absolutely right. The incidence rate map for Fayette County will go up now because that's the number of cases, different than just a positive test, cases per 100,000. So the incident rate map will go up because of this result today.
Since you're here, can you provide some information about why the state's mortality rate for COVID is steadily declining?
Yes. I have said, I'm not claiming to know with certainty what the actual mortality rate of this disease will ultimately be, but expert consensus is somewhere between 0.7 to 1.5%. We knew we weren't testing enough people early on. We remember the days we tested 30 people in a day and we were happy we could test 30 people, and now we're testing 20,000 or more on a peak day sometimes. We have huge change. So as we are now finding a lot more people who are positive, who don't die, who don't go in the hospital, we're getting the bigger denominator, the true number of people sick, and that's making those statistics look better. They will continue to improve, and when I look today, it's 1.6% mortality, that's come down another tenth just recently here, and about 2.1% ICU admissions, and about 7.7% hospitalized. Those numbers will continue to come down, and I think most people suspect it'll be about a 1% mortality rate, which is still, I've said before, alarming for a variety of reasons. It could still overwhelm our health system very easily if we let this spread. But,
And we do believe treatment is getting better and better
oh,
as
yes.
well.
There's a lot of things that are improving, but one thing, unfortunately, that's not is if we get too casual and cavalier about this, I've done this math before. If 1.5 million, 1/3 of our people get sick over a year and 1% die, it's 15,000 deaths. And if you have 5 times that admitted to the hospital, it's 75,000 hospitalizations with an average length of stay of at least 5 days or so. It would overwhelm the hospitals even if only 1/3 got sick over a year. All right.
You and Dr. Stack have just spoken at length with your mask on, and we were all able to hear you clearly. Do you all consider possibly wearing a mask during this conference to send that message that wearing masks?
It's a good idea. Dr. Stack and I have both been talking wearing masks because really we're about 8 feet, I would say, apart, but just trying to be extra careful. And as you all know, we've tried to set up the rotunda to have people far away. But it's a good point that perhaps wearing masks each time that we do this would send a good message. We do try to make sure we wear it up and wear it back so people see that we're normally wearing it, but that's something we can evaluate going forward. It's an important point that, but you know, it's also we're to the point where the vast majority of Kentuckians are doing the right thing, and some will try to find something no matter what. But it's a good point. We'll definitely consider that. Tom?
To see how Kentucky's doing compared to some of the other states about every day, and I'll see positivity rates differ widely from, let's say, would you give us to what Johns Hopkins has, to
Right.
what, at COVID now, 91 Divic, all those?
So when you look at positivity rates on some of the online websites, the data is not as good for a couple of reasons. Sometimes they have, well, first, sometimes it's not exactly apples to apples. They may have a different average that they chose for different reasons. But the second piece is they pull this information through automated programs on the web. And so, for instance, when we get up and we say the number, that's what they pull with no nuance. What they don't get is when we go back and remove duplicates, each and every day. There were 5 from yesterday. So our overall number that they would have today is 5 higher than we are reporting here, because they simply take the number most of the time of positives and add it up in their system. Some days we have 12, some days we have 15, so they don't get the audit of the data that we do, and that causes an inflation of cases.
A colleague of mine is working on a story for a bill to introduce next year by a few Republicans, including Savannah Maddox, that would prohibit required immunization of any person by any state agency. I wanted to get your thoughts on that bill, especially as we're talking about, or as we have talked about, the progress of the vaccine and what needs to happen with that in order to return to normal.
Yeah, the question's about a state representative who has participated in some of these white militia rallies and otherwise said some pretty interesting things about me. But that's part of the job, except of course the rally. Has filed a bill, I guess, to make a statement prohibiting forced vaccination. There's no plan for a mandatory vaccination. People deserve to see the information about how safe it's going to be and to make a decision, and that's how we are going to approach it. I can tell you that I'm going to take it when it is safe. There may be certain implications for businesses and whether or not you have taken a vaccine or not, but there's zero plans, and never has been, for any type of mandatory vaccination. So you can call the bill a statement if you want, or but it's I guess intended to create more misinformation that we see far too much out there. All right, I want to thank everybody. We're getting done in under the hour. We will be back tomorrow with our last update of the week at 4 p.m. Please, please, please wear your mask. We see it on the federal level. We see it here. We see it with all the experts that are on TV. We have the ability to stop this escalation and to defeat this virus. All we got to do is accept a little inconvenience, and we can get it done. Let's be a part of Team Kentucky. Let's make sure we protect one another. Thanks.